there, I'm Debbie Honeywell. I'm the discharge coordinator on Cheetham Hill ward. I'm going to take you through some of the things that I have to do to enable people to be discharged home safely.
It's about basically having a single point of contact on a ward who families, patients can liaise with to help sort out their discharges.
It's been a particularly harrowing day today. I've got two patients who are a very difficult discharge. One patient needs to leave the hospital and go into a nursing home placement. Unfortunately, the family feel that the patient should remain in hospital.
But it's also about having somebody on the wards who can work really closely with the nurses, the OTs, the physios on the ward, the doctors, to make sure that all the arrangements for people, particularly elderly people who have complex needs when they go home, are organised and arranged as quickly as possible.
She has the benefit of working across the organisations as she comes from the Care Trust, and her good experience in the practical matters of discharging patients has certainly allowed nurses to get back to their primary role, which is nursing.
When you look at the statistics, there is still a significant misuse of resources and poor patient care experience arising from people staying in hospital longer than they need.
And I think when we looked into that, what we established was there was an opportunity to streamline the processes in terms of how patients were managed on the wards.
I have another patient who unfortunately hasn't got long to live. The family don't want the patient on the ward to die, but the nursing home of their preference doesn't have a bed.
We also established that the nursing staff on the wards were spending a lot of time filling in discharge paperwork, arranging services, liaising with community-based services, and we felt that actually there must be a better way to actually manage this system.
Morning Linda, morning Angel.
Morning Debbie, nice to see you.
So we worked with colleagues in both the acute trust and the community side as well, set the role up, and the role's been really, really successful.
All the other wards are jealous that we have Debbie, and we would hope to see the model rolled out into other areas, particularly into areas like surgery, where we also do discharge outreaching.
We've had really positive feedback both from the consultant medical staff, the nursing staff on the wards.
We've actually learnt quite a lot from Debbie being here as well. And she's got some good connections, and it's those sort of things that help the discharge process move on.
We've focused on this piece of work for 12 weeks. There was a very intensive piece of work we worked on with nursing staff, doctors, community-based social workers. They're all really, really positive, and in fact they're desperate that the pilot becomes the mainstream way of doing things.
We will continue to have shorter lengths of hospital stay. Really, what we're trying to do is to give people more choice and independence, so that they're not treated any longer than they need be away from their own homes.
I've absolutely loved doing the pilot on behalf of Torbay Care Trust. It's been fantastic learning for me. As it is now, we all feel that we all couldn't work without each other, which is just a really fantastic outcome. So I would really wholly recommend that if anybody out there wants to try this, go for it.